everybody. I'm Mike Carbon from Totally Toned Personal Training. Welcome back. We are joined today by Jonathan Paine, a physical therapist from Southwest General. We're here today to talk to you about athletic knee injuries and, even more important, prevention training. Now, Jonathan, thanks for joining us today.
Thank you. Thanks for having me, Mike.
Absolutely. Hey, what types of knee injuries do you see in the physical therapy program?
Well, I would break our two major types of knee injuries into two categories, Mike.
Okay.
We have traumatic knee injuries, and then we also have overuse injuries.
Okay.
Now, the overuse injuries, those are people that, train too often. For instance, the soccer players that play year-round, all the way through indoor and outdoor seasons, never give their body a rest. Mm-hmm. And what we happen to see is with time, they're going to have breakdowns in their joints and in their muscles, and that would be classified as an overuse injury, like tendonitis and things like that.
Okay.
The other category, Mike, we see would be traumatic knee injuries. And that would be either someone takes your knee out, someone runs into your knee, that's what we call the contact injury.
Gotcha.
Or we also have non-contact injuries of types of traumatic injuries. And that's when, say, you land wrong from a jump, or you change directions really quickly and your knee buckles. Gotcha. That would be classified as a traumatic injury.
Sure. Okay. Now, what can people do, or athletes at home, our Brunswick athletes or our youth athletes out there, what can they do to help prevent these injuries?
Well, when it comes to the overuse injuries, it's really important that people take some time off during the season to let their body recover, also
Absolutely.
at the end of the season.
Sure.
And also, I can't stress enough the importance of cross-training.
Okay.
It's important for athletes during the season and the off-season to be in the weight room, to do some weight training, cardiovascular exercise, things like that. They can certainly take advantage of some of the shows you shot already on some of the Cybex equipment over at the Brunswick Rec Center.
Absolutely.
That's a great idea to do some strength training in the off-season as well, and that's the best thing for the overuse injuries is the cross-training.
Okay. Yeah, I'd have to agree with you. Hitting the gym in the off-season is going to be, detrimental to any athlete's success, not only on the court or on the field, but as you say, in prevention of those injuries during the season. Now, you mentioned, some kind of screening to actually try to assess the risk factors. Can you maybe show us what one of those tests may be or consist of, so we can let the folks at home know?
Sure, absolutely, Mike.
All right, let's go check it out here. All right, so now we're here, Jonathan, and we're going to try a screening of the prevention, correct?
Absolutely, yeah.
Okay.
The first test we have in the Sports Masters program is a triple hop on a line test.
Excellent.
And I brought a guest with me today.
Nice, hi.
Hi, thanks for having
This
me.
is Savannah is going to be our demonstrator today for our jumps in our Sports Masters program.
That's awesome.
And the first thing we're going to do is a triple hop jump on a straight line.
Well, all right, good luck, Savannah.
Thank you.
All right, Savannah, I'm going to have you start down at the edge of the end of the line there on that tape line. We're going to be on one foot. And what I'm going to ask her to do is I'm going to ask her to jump 3 times on one leg, trying to stay as close to that line as she can. So go ahead and let's try it, Savannah. Good, good. Now what I'm looking for there is, number one, she didn't lose her balance, she didn't fall. She stayed relatively close to the line. We want her to stay as close to the line as we can as she jumps down it. And her knee, we're looking to see if it wobbles too much side to side, because that does put the knee in a dangerous position. Now I'm going to have her start on the other side, and she's going to switch legs, and we're going to have her try to jump back down this way. And she'll do the same thing, 3 jumps. Go ahead, Savannah. And this is going to show me if she's better on one leg than she is on the other. Sometimes we see a dominance where one leg is much stronger than the other, and this screening process helps me pick that out. All right, Savannah, good job. You did really good.
All right, Jonathan, that was excellent. But now you mentioned how important controlling the knee position was in that demonstration. Can you tell us why that is?
Sure, absolutely. What we often find in major knee injuries, specifically when I'm talking about ACL injuries, that's the anterior cruciate ligament, one of the major ligaments in the knee.
Okay.
I'm going to kind of bring the kneecap out of the way so you guys can see this a little bit better at home. But this major ligament running from the front of the tibia towards the back of the knee is called the ACL. And it's one of the major ligaments that controls the stability of the knee.
Okay.
And what we often find when people land incorrectly from jumps, or they cut incorrectly, or they extend their foot way in front of them, the knee buckles, this is often the ligament that gives way. And it's a very important ligament because it keeps the knee stable. It actually keeps the lower leg bone, the tibia, from translating too far forward. So in order to protect that, we want to make sure when we land and jump, we land with good mechanics. Because when we land a lot of valgus or a knock-knee position, we actually put extra stress on that ACL, and there's a chance we can tear it and pop it.
Okay, I got you.
And I should also stress the importance of that ACL. The ACL also protects the cartilage. The cartilage is the 2 C-shaped pieces of meniscus here on the inside of the knee. When you don't have an ACL, what happens is your knee translates too much forward back, and it will actually tear up this meniscus, and that's going to cause arthritis at an early age.
Gotcha. Okay. Now let me ask you this. Okay, so we've pointed out kind of how the injury, contact, non-contact, overuse could happen. If an athlete does sustain a ACL injury, can you tell me a little bit about how long it would take that individual to fully recover?
Sure. There's a lot of accelerated protocols out there, people trying to rush athletes back in the game. There's a lot of pressure to do that.
Sure.
But it's every bit of 6 months to do it correctly, and often more than that. You know, if they tear more than their ACL, there's other ligaments as far as the lateral collaterals and also a PCL in the back of the knee there. If you damage cartilage or tear more than one ligament, it could last up to a year just to get back on the court in rehab. And then to get back to where your previous level of function, you know, to be performing well, it's even longer than that. It could be as much as 15 months, you know, a year and a half.
Right. Wow, yeah, you know, 15 months, that's a long time to be out of commission, you know, in any sport. Let alone, you know, once the body does heal, I know a lot of athletes who've had the injury and then, you know, you got to kind of get your feet back because you don't really trust the injured area. You kind of still want to baby it, you know, which is why, you know, that really shows the importance of, you know, having some kind of injury prevention program, you know, either, you know, with an athletic trainer or, you know, just making sure, like Jonathan mentioned earlier, you know, working in the off season on that cross training to really strengthen those areas. Now, I do know that Southwest has a ACL injury prevention program, correct?
Yes, absolutely.
It's called Sports Metrics, I believe. Can you tell the folks at home a little bit about that?
Thanks, Mike. Yeah, Sports Metrics is actually a nationally acclaimed ACL injury prevention program that we brought to Southwest. It's a very intensive program. It lasts 6 weeks in the off season. The athletes come in 3 times a week for between 60 and 90 minutes, and we run them through a very intensive workout. Awesome,
that's great. Now, can we maybe show the folks at home one of the tests that may be done to kind of, you know, analyze where the athlete may be in this situation?
Absolutely.
All right, let's do it. All right, Jonathan, so here we are. We're going to do another prevention analysis test. Is that correct?
Yep. One of the other tests we do during the assessment in our Sports Masters program is we like to do a drop jump test. I usually use about a 12-inch box. And what I'm going to have Savannah do is she's going to jump down, hit the ground, and as soon as she hits the ground, she's going to jump right back up. And this is actually going to give me a chance to look at her knee alignment with that impact.
Awesome. Okay, well, good luck, Savannah.
All right, Savannah, just like we were talking about, I'm going to ask you to do this 3 times. You're going to jump down on the floor right in front of you, and as soon as you hit the ground, you're going to jump right back up and give me a really high vertical jump. All right, go. Let's try it. Good, looking good. Now what I'm looking for here is her knee alignment when she hits the ground. What we want to avoid is any kind of valgus or knock-knee position. That actually puts your knee in a position where you could easily tear your ACL. The other thing I'm looking for is how hard is she hitting the ground. If I can hear her hit the ground very harshly, very loudly, that means she's creating a lot of what we call ground force reaction. She's hitting the ground very hard. That's also something that we want to watch very closely. But good job, Savannah. Excellent. I would play that back in slow motion in the lab, and we might see things a little different, but she looked very good at full speed.
Now let me ask you this, Jonathan. I noticed that there's 2 jumps being done here. Obviously, we're looking at the vertical and the second jump. But is it going to matter how high she's jumping off the box? Does that matter? Or?
No. It's actually, we want her to jump down right in front of the box, and then we actually measure her vertical height when she takes back off, and I'm looking at her knee alignment when she hits the ground that first time is where I'm really looking for her knee alignment.
Got it. Awesome. All right. Excellent. Good job. All right, Jonathan, so now that we've been tested and we kind of know where the athlete is and what kind of things we'll be looking for to work with that athlete specifically, can you tell me a little bit about the actual strength training or the helping the athlete build that endurance so that way they can prevent this injury?
Sure.
And maybe what that consists of?
Sure. Yeah, absolutely, Mike. Yeah, our program Sports Metrics consists of 5 components. We start off with a dynamic warm-up to where they move across the court of the field they're working on, getting loosened up and stretched out. Then we go into the plyometrics, which are the jumps. After that, we do a comprehensive strengthening program. Now, we're not just strengthening the muscles and the legs to help support the knee. We're going for the whole body. We're going after core and upper body as well.
Excellent. That's
and then after we run through the strength exercises, we get into our speed and agility exercises. We teach them how to cut and change directions correctly, as well as making them faster and making them more agile. And then after that, we end with our stretching, some static stretching to end that all.
That's awesome, yeah. You know, I think, like I mentioned earlier, the body mechanics in any sport, knowing the movements, you know, not just out there running for your life, but actually knowing what position the legs should be in when you're trying to move a certain direction and things like this. Having not only the muscular, like you said, but just the whole body, the core, which is involved in, you know, many different movements that you make in any activity, making sure that's strong. So I think that's awesome. But, you know, 60 to 90 minutes, that sounds like, you know, pretty intense workout that you're doing there. Can we show the people at home some of the, you know, typical kind of things that you would do in one of these sessions?
Absolutely. Let's go.
Let's do it. All right. All right, Jonathan, so now we've been analyzed. We kind of know where we are. We know what we need to work on. So now can you show us a couple of those the strength training actual facets of this? Let's start with, you mentioned the dynamic warm-up. What would be done with that?
Yeah, absolutely. There's 5 components to the Sports Masters program. The first is going to be dynamic warm-up.
Okay.
I'm asked Savannah to start on the other side of the stage here for me, and we're going to do a high leg kick. So trunk nice and upright, knee straight. You're going to kick your leg up nice and high, and you're going to walk from one side down to the other. Good. Her trunk's nice and upright. This is a really good dynamic stretch for our hamstrings.
Okay.
I'll turn around. She'll head back the other way a couple. Good. Nice and controlled. And she's got very flexible hamstrings. She's not struggling with this. I would have a harder time.
Great job, Savannah. Okay, now the second one you mentioned was plyometrics.
Yes.
What's involved in this
Right.
exercise?
There's several jumps we do during the 3 phases of the program, but the one I'm going to show her today is called a long jump and hold. So I'm going to have her start on 2 legs. She's going to jump as far as she can, and she's going to hold the squat position for 5 seconds. So why don't you start over on that side, Savannah, and give me a nice long jump and hold for 5 seconds. Good. Hold 1, 2, 3, 4, 5. You can come back up. This is a great exercise for strengthening the hamstrings, and the hamstrings play a vital role in helping stabilize the knee joint and actually reinforcing what the ACL does.
Excellent. I know somebody might be in the Olympics in a couple of years. All right. Now the third facet that you mentioned was the strength. What can we do there?
Absolutely. We're going to cover a comprehensive strengthening program. One of the most important things I like to work is the glute medius or hip abductors, and I'm actually going to have Savannah step into this band for me. And put the other one. And what we're going to do is a nice squat position. I'm going to have her do some nice side steps for me. Just step a couple steps that way and a couple steps this way. But let's get down to a nice squat position, and let's see you step across the stage for me. This is firing her glute medius, which is her hip abductors. And this is a very important knee that will this is an important muscle that actually stabilizes the hip to help protect her knee.
Excellent. That's a good exercise. I like that. Perfect. Good. All right, now number 4 was the agility.
Correct.
Agility obviously is going to be very important, regardless of what your sport is. So what can we do to work on the agility?
All right.
Take that. Thank you.
Now today for agility, we're going to run through a program. We're going to run through a drill called the Nebraska drill. I'm going to use 2 cones. I would normally have them a little bit farther apart, but I think this will demonstrate the purpose very well. I'm going to have Savannah start down at the other side of the course here, and she is going to run a figure 8 through these cones for me. So go ahead and show off for me, Savannah. Let's run a figure 8 pattern. And I want you to touch each cone. Good. Get that cone. And then touch the forward one, and then back pedal. And then a very important thing we're looking for on this is how she actually rounds that corner. She did a good job of getting down low and touching the cone. That keeps her knee bent and will actually protect the ACL quite a bit and keep her in a safer position. What you really want to avoid when you're cutting around a cone is you don't want to cut on a very straight leg, and you also don't want to cut on the inside leg. Those would also put the ACL in a bad position.
Right, absolutely. Yeah, you want to keep the knee joint bent to avoid any bone-on-bone, and then obviously you want to not put yourself in a weakened state. So that's great. Now the last one was the flexibility. Obviously, flexibility in any sport is going to be pretty important, so we want to make sure we're flexible. What kind of things would you do there?
I like to stretch the whole body, but one of the things I see people miss quite often is actually hip flexors. So we'll go ahead and maybe I'll face the camera here and Savannah can go sideways for me. We're going to put one knee down, and we're going to lean forward so we get a stretch in the front of our hip. You're going to keep your trunk nice and upright. And you're going to hold 15 to 20 seconds. We're going to try this 3 times on each side. We'll go ahead and switch. And then same thing on the other one. Leaning forward, trunk upright, stretches the hip flexor and the quads as well. And that's our 5 components of the Sports Masters program.
Excellent. That sounds very beneficial to anybody in any sport. I think it would help us out a lot. Savannah, you did a great job. Thank you so much for helping us. Jonathan?
Thank you, sir.
All right, great. That was an amazing little workout there. I think that would be beneficial for any athlete in any sport, really. But let me ask you this. Are there specific athletes or specific sports, you know, maybe ages or groups of individuals that you really target with this program?
Yeah, absolutely. The adolescent females, we're talking about girls in high school all the way up to college age, are at dramatically higher risk than guys. They're about 6 times more likely to have a major knee injury than guys in their same age bracket. So we want to go after the girls that are playing soccer, volleyball, lacrosse, any any kind of contact sport, lots of jumping, running, or quick changes in direction. Those are the kids we really want to target.
Wow, okay.
Although it's good for boys as well, I should say.
Sure, yeah. Now, absolutely, like I said, from what I've seen, working with the high school athlete, just on the strength training aspect, in the gym, the body mechanics have a lot to do with it. Knowing the position, knowing the proper routine, and obviously, making sure that we can stay as strong as we can, especially before considering too heavy a weight. That kills me at the gym when you see the individuals trying to do, some obscene amount of weight and it's not being done properly, or with the range of motion. Remember, folks, range of motion is key in any exercise that you do. Own the motion that you're performing. But let's see here. Now, for the parents and coaches at home that would like to learn more about this great program that you offer, how can they get in touch with you, and how can they find out more information? They
can contact me at Southwest General Sports Medicine Program. You can call us at 440-816-8010, or you can email me personally with questions at jpaine, J-P-A-I-N-E, @swgeneral.com.
Excellent. Jonathan, thank you for being here.
Thanks for having me, Mike.
Absolutely. Everybody at home, I'd like to thank you for joining us today, and I do want to remind you, please always consult your physician before starting any kind of exercise routine. Whether it's preventative or strength training, you always want to make sure that you're good to go before you try anything, okay? Thanks again, and we'll see you next time.